Hello, I'm Dr. Mike Augustson, and I'm a family doctor. Thank you for participating in Healthcare Revolution Sunday. It is my hope and prayer that this will be a blessing to you, your church, and your community. The idea for Healthcare Revolution Sunday can be traced to this setting. This is the exam room in the clinic my pastor and I and several others started several years ago in the early 90s. This clinic is for the medically underserved. Experiences in this clinic have taught me so much about my faith, about health and healing, and about the role of the church in helping to solve societal problems. While we in America have much to be thankful for in health care, especially with some of our technological advances, we also have some great problems. The cost for health care is very high, and there is a question of value. Studies show that in America, we spend almost twice the amount than other industrialized nations spend on health care. Yet, when we look at how healthy Americans are, we are near the bottom of the list. Then, there is the uninsured, people who have no public or private health insurance and have almost no access to health care at all. We need fundamental, radical, revolutionary change. This change can happen. A while ago, I was talking with a person who seemed overwhelmed as we considered solutions. The person said to me, "I just wouldn't know where to begin." Well, I do know where to begin. Can I show you? Dwight Moody, the great evangelist, said, "Every great moment in history can be traced to a kneeling figure." Will you be that kneeling figure? Prayer is our communication with God. God speaks to us and we are to listen. We speak to God and God listens. The problems we're dealing with in healthcare are highly complex. People have been trying to solve them for decades without success. We need the wisdom of God. We need God's divine intervention. Prayer will give us both peace and purpose. It will inspire us and give us the courage and commitment to accomplish great things. Prayer will help us bring about a healthcare revolution of a different kind. So what can prayer inspire us to do? I propose a strategy focused on three areas: our health habits, our health ministries, and our health policies. Our health habits are the actions we take on a periodic or regular basis that affect our health in either a positive or negative way. In the United States, about half of all deaths can be attributed to the personal actions we make on a day-in and day-out basis. Examples include overeating, lack of exercise, or smoking. Often, these actions are the result of our personal sin or the sin of others. These are also best dealt with by a loving and forgiving God, as well as a supportive church family. Health ministries are a congregation's organized efforts to bring about physical, psychological, and social health from a spiritual perspective. Numerous programs are available to train lay parishioners in these ministries. Examples include Christian caregiving, parish nursing, or even conducting healing worship services. People who are part of a church family are fortunate, for in this setting is the opportunity for relationships to bring about higher levels of health and healing. For such programs to be effective, parishioners must realize their need to be healed and their call to heal. Matthew 9:35 essentially says that the ministry of Christ is about teaching, preaching, and healing, including the healing of every kind of disease and illness. As Christians, we are called to model the whole ministry of Christ. Health policies are the laws government makes to promote the health and safety of its citizens. The most pressing health policy before our state and nation is the development of a health care system in which every citizen has access to a basic level of quality and affordable health care. As an engaged parishioner, you can help bring this to reality. I'm convinced it will not happen without your involvement. I plead with you, be the salt of the earth and the light of the world. Hold our elected officials accountable for effective leadership in this most important area. I believe the church, which helped begin almost every hospital in America, is on the threshold of playing a significant role in the way people experience health and healing. A while back, I saw a billboard highlighting an individual, and the billboard said, "Some people wish for peace, others work for peace." Will you work at praying for a healthcare revolution of a different kind? Will you pray without ceasing? Will you work on better health habits? Will you work at growing the health ministries in your church? Will you work for better health policy? In so doing, I believe we will better model the whole ministry of Christ, and we may very well come to experience a blessing none of us could ever imagine.